what are some of the challenges when it comes to in maintaining interdisciplinary care for patients? Whether it's gaps in records or just gaps in communication, where are you finding most of the spaces where patients kind of could use improved care, communication, and things along those lines?
I think the challenge is most patients who undergo bariatric surgery get lost to care, if you will,
Mm,
from their surgeon's office or from their bariatric provider, and making sure that we incorporate pathways within primary care where they'll be seeking kind of their regular health care and health maintenance, to make sure that clinicians in those areas have appropriate resources for screening for post-bariatric deficiencies, for helping to address potential post-bariatric complications like dumping syndrome, and to make sure that clinicians are aware about bone density screening and other factors that should be done. Obesity is a very chronic and complex disease, and there's a variety of different responses that we're going to see to any intervention,
mm,
be it a diet, be it bariatric surgery or
mm,
anti-obesity medications. And I think it's so important for us to educate our colleagues and our peers with regards to the variety of responses that can be seen,
mm,
so that when patients come in and they don't have the average or expected change in body weight, that
mm,
we're able to talk through this with the patients without having stigmatizing reactions to their lack of weight loss. I think it's so important as we acknowledge a challenging disease like obesity to make sure that we meet patients where they're at and we provide them with care that would be analogous to any kind of disease state. If somebody comes in, for example, with high blood pressure and we start a medication and their blood pressure is not within goal, we don't give them a hard time about the medicine not working, right? We add another therapy, we find something else that works. But when it comes to obesity, unfortunately, there can be a lot of stigmatizing experiences that patients have where clinicians may expect everybody who starts on a treatment to
mm,
have a similar response to what they see. And so I think it's important for us to have these conversations with peers so that we all understand the challenges of treating obesity and how to approach this in an evidence-based way, but also that we can have constructive conversations with our patients.
mhm. How does mental health come into play with all of this? Because we've talked about the stigma of obesity often not being seen as a chronic illness, even in healthcare fields. And, when we think about people's relationship with food, there is often sometimes an emotional aspect to it. So when it comes to quote unquote success post surgery or, quote unquote success post, medication, how are we kind of discussing patient mindset, emotional state, and things like that? Are those conversations that are even being had?
They're conversations that should be had,
Mm,
and unfortunately, I think many clinical settings in which obesity is being treated or in which patients are accessing obesity medications, there's neither the time nor the resources for this to be done in an effective or iterative way. And to kind of cut to the chase, I think things that are important to make sure that we are screening for mental health challenges in our patients. I think all of us are living in a state of stress and sleep deprivation in a way that impacts our mental health and our overall health. And so making sure that we provide appropriate support, coaching, and interventions to our patients who are on any kind of health journey or even as a matter of primary care. Mental health professionals can be incredibly helpful for helping patients to identify what it is that they want to work on from a health and weight perspective, what their why is, to put in place, if you will, kind of using the SMART goals kind of framework to set actionable items that they can work on so that we can see progress, maintain engagement, and if not, troubleshoot with the patient and be supportive.
mm.